So this is the physical exam about health assessment chapter. So when we prepare to examine a patient, first of all, we gather all of the equipment first. So gather the equipment needed for exam. Like if you want to measure the measurement of blood pressure, definitely you have to have the blood pressure machine, a stethoscope, right? So you have to gather it first. Then you go for the exam. And use the sense of sight, smell, touch, and also hearing to collect the data, right? So like a patient has a psychiatry patient, mental health patient. So patient will not maintain their personal hygiene or grooming. Maybe you can get offensive smell. If a patient are alcoholic, when they talk, you can get the smell. When you touch them, you can understand their body temperature, they are feverish or under hypothermic condition, right? Data collection should include the inspection, palpation, percussion, and auscultation. So this is the 4 steps for physical exam with patient. And this skill are performed on 8 times, once or one at a time. And in this order, except for abdominal assessment. So we said the first one is a inspection. So what you can see. Number 2 is palpation. So when you palpate superficial and deep palpation, you can palpate the organ, kidney, liver, spleen. And number 3, we do the percussion. Is it tympanic or dull? And number 4, auscultation by stethoscope, lungs, like lungs auscultation, heart auscultation, S1, S2, or murmur. So this is the consequence. 1, 2, 3, 4. Inspect, palpate, percuss, and auscultation respectfully. But if you examine or physical exam for abdominal system, it is important to know. What is important to know? Because of abdomen examination or assessment, we follow inspect first, then percuss, auscultation, and lastly palpation. You have to change it. And next here, so data collection techniques. Data collection techniques primarily used by the licensed practical nurse or licensed vocational nurse include inspect, some palpation procedure, and auscultation. So a patient when come to hospital, means during the admission, aren't supposed to take the history and assessment. But here said that data collection may be subjective or objective data. Collect techniques primarily used by the licensed practical nurse can do this. Now go for inspect. So the first data collection techniques used vision or smells sense while observing the client. So like you are sitting in a table, you are the RN. When a patient come in the room, your examination start. Because you can see, you can watch how the patient walking. Is it any abnormal during walk? Any gait abnormalities? When they're sitting on the chair, any postural abnormalities? They have any curvature in the spine? You can see your examination start when patient enter in the room, because you are very special. You are not the as usual public. So first data collection techniques uses the vision and smell sense. So you can watch, you can see your patient and you can collect the data. And when patients sit, if patient are alcoholic, you can get an alcoholic smell. If the patient is a uncontrolled diabetic mellitus and patient develop the DKA, diabetic ketoacidosis, the patient breath should be fruity odor, right? So when you get the fruity odor smell, you can get, okay, maybe my patient has a complication of diabetes mellitus. So smell and you can get the data. Require the good lighting during the exam, also adequate exposure or properly use of certain instrument by registered nurse or primary healthcare provider who is the examiner, maybe doctor, physician assistant or nurse practitioner, such as also they use otoscopic to examine the ear or ophthalmoscope to examine the eye. Now, palpation. So during the palpation, use the sense of touch. Warm the hand before touching the client. Identify tender area and palpate them last. So during the, imagine a patient has a 4 areas in the abdomen, right? Upper left quadrant, upper right quadrant, then just 4 area, I say lower right and lower left quadrant. So if you start the, imagine the patient have a pain in these areas, right? This quadrant. And this quadrant you could palpate last. So you can start the palpate the right lower quadrant, then go right upper quadrant, then go left upper quadrant, and finally left lower quadrant. So they said we examine, we'll start the light palpate to detect the surface characteristics and then perform deeper palpation and check the texture, temperature, and moisture of skin, as well as organ located inside, and check for swelling, vibration or palpation, rigidity, septicity, and crepitus. Also check for presence of lump or masses, as well as presence of tenderness. So if any tenderness there, we could note, right? So what next? In this picture, In first picture, the light palpation. This is the healthcare provider patient. Start from one quadrant, lower quadrant, upper quadrant, then move or rotate. And if patient have a tender any area, it will be tested last. Superficial palpation. But picture number 2, we can say it is deep palpation. So you can pressure by upper hand to over your second hand. And if any mass, you can feel. If the kidney is palpable, you can feel. If the liver is enlarged, spleen is enlarged, splenomegaly, hepatomegaly, we can feel it. Now go here, now go percussion. So in this picture, you can trap by the tip of the finger over your other finger, and you can see, hear the sound. So this is the percussion, and this one is auscultation. Use the stethoscope. So percussion, the examiner will tap the client's skin to check underlying structure and determine the presence of vibration and sound. And if present, we can note the intensity, duration, pitch, qualities, and also location. Provide the information related to the presence of air, fluid, or solid masses, as well as organ size, spleen, and position. So like you are examining a patient lungs, right? When you examine a patient lungs, so if you get any added sound inside the lungs, or if you get any pneumonia or hydrothorax, hemothorax, you can write it down, right? You are going to palpate in the liver system, and you get the liver is enlarged. It is called splenomegaly. So you can keep the note, the size of the liver, the shape of the liver, and also position, how long it is enlarged. And also if lungs contain any fluid, right? Or if lung contain any extra air, we call pneumothorax. If the blood, we call hemothorax. It should be included in our documentation. The auscultation involves listening to the sound produced by the body, such as heart, lung, or bowel sound. So sound not only produce your lungs, your heart, also GIT can produce the sound. When food is passing by through the lumen, a sound is produced. It is called bowel sound. Next, data collection techniques. Now going to focus vital sign. So vital sign include temperature, radial pulse, respiration, blood pressure, pulse oximetry, and presence of pain. So include temperature. What are the normal body temperature? You could know. And radial pulse. So what are the pulse you can get in the wrist joint? It is called radial pulse. Apical pulse means what you can get over the heart fifth intercostal space, right? It's called apical pulse. Maybe measured during the cardiovascular data collection. Now, respiration. What is the normal range? What is called apnea? Blood pressure, systole and diastole, and also pulse oximetry. And finally, pain. So pain is also the vital sign. And also we can measure height, body weight, nutritional status. If you see this patient is not overweight, not underweight. He's average, right? And also when you get the body height and body weight, you can easily measure the BMI. BMI stands for body mass index. So it can indicate your patient is obesity or undernutrition, or patient who is within normal range of BMI. Now here, data collection techniques use the patient weight and height measurement to calculate the BMI. What are the formula? Formula said body mass index, weight in kilogram, and height in meter square. So sometimes NCLEX board give the mathematical problem. You have to solve it by using this formula. Like my patient body weight is 180 pound. So this 180 pound you have to convert to kilogram, and 1 pound equal to 1 kilogram equal to 2.2 pound. So 180 divided by 2.2 pound, and you will get the weight in kilogram. And like my patient is body height is 100 meter as support, so it would be multiply by 100, or it would be over square 2 because of the formula. Now here the risks of obesity, associated disease and condition by BMI. So if when you get the BMI, you can easily find out who is under the risk to develop the cardiovascular disease. So this is the wrist circumference relative to the normal weight and wrist. So circumference, disease risk factor for type 2, hypertension, and cardiovascular disease. Let me tell you the normal BMI here. They said BMI normal, it is 18.5 to 24.9. So if the BMI is less than 18.5, you can say underweight. If you found the BMI more than 25 or in between 25 to 29, it is overweight. And when you can say obesity, if your patient BMI is more than 30, it is obesity class 1. Obesity class 2 when more than 35. So these two patients have a chance to develop hypertension, cardiovascular disease, or type 2 diabetes. The patient who is overweight but less than 29, you can advise them, educate them to control the body weight. means reduce the body weight. So they can prevent the type 2 diabetes